I'm Gavin from Maple Clinics. I'm sitting here with Max today. This is one of our information sessions. Today we're talking about spinal decompression. So if you're here on this video, there's a special offer for you guys. Just click the link below. You can find out a bit more about that, okay? But here we go. Let's talk a little bit about decompression.
I actually don't know how you got in contact with Jake. Do you want to run through how we ended up getting in contact with spinal decompression?
Well, Jake's a little bit further down the line. That's more recently, kind of in the past 8 months. So that's Vert Biotech, obviously the company that we got our spinal decompression machines from. No, but my how I got into looking into it anyway, spinal decompression was, well, you'll probably remember this well. We're talking about 2022 when I had the cervical disc herniation, C5, C6, pretty significant level of pain down the arm, some weakness. I had to stop working because of it. It happened actually, a couple road traffic accidents, whiplash injuries, ice hockey injuries, but really a culmination of things over the years. And then I had a busy schedule working, and I was working that day when I finally felt the straw that broke the camel's back, as they say, where I started all of a sudden to have nerve pain going down my arm. So it was then that I was thinking, we were doing kind of just cervical traction on my neck. I think both you and Dan were working on it quite regularly. After about 2 or 3 months, kind of chiropractic adjustments and cervical traction, we were getting quite a good bit of relief. No longer any pain in the arm. A little bit of cervical pain remained, but went back to work, and within about 3 weeks, it came back with a vengeance. So we worked on it daily for a period of time then, and then we got to that point where I thought, we got a little bit better. I didn't know if it was going to get completely better. So I was looking into spinal decompression when we started doing kind of the individual spinal decompression unit just for the neck, and had good results coupling that with chiropractic care, some manual cervical traction. But after about 5 months, everything resolved. But I was at the point where I thought, geez, am I going to need to get a surgery here? And I absolutely didn't want to do that unless it was going to be completely necessary. So we did get a resolution, but all my homework at that time, I had a lot of spare time on my hands because I wasn't able to work due to the pain. But I did a lot of reading at the time, and kind of, you're talking over the next kind of 18 to 24 months. Coming out of the pandemic was quite a busy time anyway, getting everything back on track with business, hiring, and getting up to speed again. And then I was able to kind of have a little bit more time looking into it. And I basically looked at a company in Canada, a couple of companies in the US, and finally came across, I was trying to find the best available spinal decompression technology that's there on the market at the moment. My thought was, let's start with the best, see if we can get it. And if that's in our price point, it makes sense, then that's what we'd like to do. And then kind of Shinma Medical, it was, for me, leaps and bounds above the other, okay? Because mainly what that bench could do had so many more options than just a straight axial decompression that some of the decompression we're doing. I understand the technology for it with kind of the drive shaft decompression started in the US, but in South Korea, they just took it, built on it, and continued to develop. So in doing my homework, that was really the only one. There wasn't anything that could compete with it in terms of potential. So that's why I got into that. So that's been an 8-month journey with them, going back and forth. As you know, we did a lot of the research sent from the hospitals in South Korea, and they came and visited us as well, which was excellent. So we got firsthand experience with them. So that's how I got into it now. In a roundabout way, we knew that in our clinics, there's a certain level of patients that we weren't able to get the complete result that we were hoping for. Some patients we really couldn't help at all. And this was it's kind of the gold standard. This coupled with chiropractic care was the gold standard for from our profession, trying to help people with disc injuries. So, and then to find out how many people with kind of chronic degenerative change, chronic pain from the neck, chronic pain in the low back from degenerative change, it's been kind of massive change in people like that maybe our just traditional adjustment wasn't getting the same result. So that's how we got into it. Now we've introduced it, and we're getting fantastic results as we anticipated we would do. And probably a little bit overwhelming. It's we're able to use it on certain patients that we wouldn't necessarily thought we'd be able to use it on. So it's quite diverse, which is excellent.
Yeah, awesome. Perfect. So I think that moves nicely into what is spinal decompression, what is the MC core, which is the actual kind of bed we have. Obviously, one of the main points about it is it's non-surgical, of course, which for a lot of people is going to be that last kind of option maybe for a lot of people in terms of maybe similar to yourself in terms of not wanting to go down the surgery route. being able to have some really, really great results with it. It's computer controlled as well, which I think we're going to get into in a bit more detail what that actually means. But usually it means it's going to be a bit more specific to the individual rather than just a straight kind of pulley system that we've seen as well. And of course, decompression is gently reducing pressure on the discs of the spine. It's gently reducing pressure on the nerves, the joints, and of course some of the surrounding tissues. And that's going to be one of the big things about it, isn't it? Yeah.
Yeah, well, I think just to add to that, the decompression, even with kind of the systems like the pulley type system, they can isolate to a certain degree. But as you said there, we can, because of the drive shaft system, you can isolate it very specifically to 1, 2, and 3 segments, which means the other parts of the spine aren't being involved, aren't being affected. So people who have other issues might not be able to go on certain machines. They are able to use this one, which is excellent. But what that does, the decompression, is it brings your spine into a position where you're creating neurological space for a prolonged period of time or a sustained period of time. And you can adjust that time depending on the patient. And as they begin to get better, you can increase that amount of time so they can tolerate and handle more. So you get the maximal benefit from each individual visit.
Yeah, and just on that kind of personalization as well, where it's able to take people's height, weight, age, and of course, if they've got imaging like MRIs and X-rays, which tell us precisely which disc or joint it is, we're able to input all that information into the machine, which of course gets the more specific result to them in terms of their tolerance, maybe how much it's decompressing at any one time, those kind of things as well.
Yeah.
Awesome. Perfect. How does it work? The actual specifics of the machine is really where we're kind of going on to next time. So it's gentle, it's rhythmic, it's AI assisted, and which has been described as giving it real time biofeedback. What I mean is, or what we've seen of it mean is, but when it's pulling, it makes those micro adjustments, or when it's decompressing, it's making those micro adjustments depending on, again, your sort of tolerance, the amount of muscle tension which is there, these kind of things. So it may decompress for a little bit. It may choose to back off at certain points. It may choose to then decompress a little bit more again. If it's able to get a good amount of space in the disc, then it might not even pull to as far as we've set it to because it doesn't feel it needs to, which again is going to help kind of reduce with that sort of chance of muscle spasm as well. So that's what we really mean when we're talking about getting kind of real-time biofeedback as well.
Yeah, well, I think the feedback you mentioned there is crucially important and something that separates this type of technology. And there are a couple other machines that do the same that really kind of minimize the chance of that muscle spasming that you're talking about, kind of the irritation if the pulley type systems might have greater susceptibility to that, which means that we can use this in a more acute patients as well, which typically you're not necessarily are able to use on certain types of technology. But that level, the advancement that they have, I think we probably should note on the fact that, say, you have a disc bulge, to the back and the right, posterolateral on the right side, you can adjust the machine accordingly to open up that side a little bit more, so that when it is distracting and holding that position, it helps with that disc retracting into its normal position as well.
Yeah, because it does decompression and it also does something called smart therapy, which is spinal mobilization and rotational therapy. So there's a decompression aspect of it, there's that traction aspect to it, mobilization of the spine and the rotation of the spine, lateral flexion of the spine. So it's a 3D movement. It's not just that pulling, it's that rotation one side. Yeah, like you said there, if there's a disc bulge to one side or a nerve irritation to one side, it can use that information to, of course, make sure we're targeting one specific side through the mobilization, through the rotation, through the lateral flexion, which is why it's described as a 3D system as well.
Yeah.
Awesome. Perfect. So results in the spine, what is it actually doing underneath you?
Well, I think decompressing kind of explains it for a lot of people. You're taking pressure off a lot of tissues that have been compressed over a period of time, depending on the way your spine's been loaded. It's almost predictable the way your spine is going to wear or degenerate, depending on the things you do with it over the course of a lifetime, particularly, let's say, a specific job that you might be doing. You're putting it under a particular stress for a long period of time. It's almost predictable how that might look on an X-ray or an MRI. So what it's doing is basically decompressing all of those tissues that have been compressed and irritated over a period of time. Mm-hmm. Not the least of which would be the discs and the facet joints in the spine. But when you decompress the spine, you're going to get pressure off the disc, pressure off the associated nerves that may be irritated. Mm-hmm. But the posterior longitudinal ligament that runs down the inside of the spinal canal as you begin to wear or degenerate, it's not elastic tissue, so it begins to bend or fold on itself, and some of that can go into the canal area. Okay, and if that does, it begin to encroach on the blood supply to the nerves, which is another source of pain is when you have poor blood supply to those peripheral nerves. So when this decompresses, it stretches out that longitudinal ligament as well, which takes away some of that encroachment in the cord area.
Yeah.
So it's multifaceted, but I think in the simplest way is just say it's taking tension off a lot of tissue or decompressing tissues that have built up over a long period of time or as a result of a traumatic injury. And most importantly, increasing blood supply to the nerves, creating space for the nerves, and helping to rehydrate the disc as best as possible.
Yeah, and on top of that, I'd also add it improves oxygen to that targeted area, and it improves obviously hydration, which, like you said, is also through the improved blood flow as well, which of course is we want to improve that hydration, particularly in disc issues as well. So yeah, I mean that's
in the simplest way though. If you're visualizing it, it's just as if you have that disc back there, just being pressed down. You're lying on your back. There's no gravity coming down the way, so you're allowed to just decompress and pull all of those tissues away from each other, which is going to alleviate pain in the process. But as you be able to do that for longer periods of time, that becomes, or what you're trying to retrain the spine is to be the new normal, bring it back to how it should be. And these other types of movements that we can integrate in the latter phases of care allow you to restore all the structure of the spine as well. And proper mobility.
Yeah, awesome. Perfect. Yeah, so of course people that are listening to this are obviously trying to find out if it's for them. Who is it really for? What kind of issues and what kind of people? Yeah,
well, it is a good question because a lot of times when you're suffering from pain, it can be quite frustrating. You've tried everything. Even ourselves, we know there's certain patients that haven't responded as well. So generally speaking, a lot of people can benefit from it. But who are the main patients with problems is going to be chronic neck pain, chronic low back pain, people with degenerative changes in the cervical or lumbar spine, so often referred to as wear and tear, where you're going to have some possible osteophytes, bone spurs, wearing of the bone, and wearing of the disc as well, and people with acute disc herniations and disc bulges causing pain, whether that's in the neck or the low back. Now, that said, these people are symptomatic patients who are going to benefit the most from this type of care, but just decompressing your spine is a nice therapy for people who are trying to maintain the health of their spine over the course of their lifetime. So there's benefits to that as well for just general health and well-being of the spine.
Yeah. And I think on top of that as well, of course, a lot of people, maybe their issues feel like it would be resolved through manual care. They've had lots of manual care. They've been to chiropractors, been to osteopaths, been to massage therapists, et cetera, et cetera. If they haven't found a resolution, they might not be necessarily aware that this is another option. And yet again, I think they would be also a kind of category in themselves, wouldn't they, in terms of people that maybe have tried everything else and are still trying to find an answer to whatever problem they're kind of dealing with in that area.
Yep.
Awesome.
Probably worth mentioning as well that patients who unfortunately can't use it.
Yeah.
And that is obviously if you've had a previous spinal surgery where there may be any kind of pins, rods, or anything in that area of the spine, then you aren't unfortunately able to use it. As a result of that, you can't safely decompress those areas. On top of that, anyone who has any kind of active cancer in the body, they too wouldn't be able to use it. I mean, you can help isolate where that cancer is, for instance, but if there's any chance of anything being in the spine, of course, you can't use it. Any kind of moderate to severe level of osteoporosis, there's not enough stability in the spinal bone to do that. There's a fairly bit of force that comes with decompression. So again, it's not safe for those patients as well. So they may be suffering from the chronic pain and chronic back pain, but unfortunately, as a result of that, they wouldn't be able to use the machine.
Yeah, awesome. And then I guess, is it just a sole therapy, or are you going with, or can you do it with other things? Obviously, at the moment for us, it's been we are doing it as a sole therapy. Particularly, I think if people have tried everything else and maybe not got a result, but predominantly we've been using it alongside chiropractic, haven't we? Because we think it goes really, really well. The results that we've had with it have shown it's gone really, really well with chiropractic because it's allowed us to probably improve the amount of mobility we've been able to get through specific spinal joints, particularly if there's a lot of spasm or garden. It's helped us from a chiropractic point of view. So yet again, I think it's also when you're coming in for an exam with us, we might be able to discuss whether we think it's going to be something we should be doing on its own or whether it's something we can combine with chiropractic as well.
Yeah. Well, I think, as you said, there are some people who have tried everything, and maybe they've tried chiropractic on its own and it hasn't been effective, or physical therapy or sports therapy. they've had good relief, but maybe not lasting relief, or in some cases, no relief at all.
Mm-hmm.
So I understand the frustration, and I understand the thought that maybe they just want to use that exclusively. In some cases, that can be done. And the good thing about this technology is because of the lateral flexion, because of the rotation, you still get segmental motion. And based on the best evidence available, segmental motion or lack of segmental motion is a significant contributor to pain arising from the spine.
Yeah.
So with just normal decompression, we typically wouldn't advise using it on its own because you're not actually getting segmental motion back to those areas of the spine. But with this technology, you are able to do that as well. So on its own, sometimes it will be enough. However, as we said, if you couple that with chiropractic care, so you get specific segmental adjustments, that is going to increase the chances of a positive outcome for you.
Yeah, awesome. Perfect. So yeah, I think sometimes decompression, pull-in can seem quite not violent, but can seem sometimes it might be quite sore, that kind of thing. So in terms of actually how it feels, then I would just want to quickly talk about that. It's of course actually quite gradual and it's quite relaxing for a lot of people in terms of when they're having it. It's always going to be quite a gentle stretch in terms of it. When people start off, we always talk about a loading phase, don't we? Which is usually that first week where we're kind of maybe trying to get the right kind of tolerance, like we said, because we can adjust time and force and angles, these kind of things. We're always going to start a little bit more kind of at this tail end. It's not going to sort of all in one go, and just kind of gradually build that up to make sure that there's not going to be any kind of moderate or severe soreness after it as well. So yeah, it is very gentle. It's very relaxing. It's not going to be anything too aggressive of that kind of thing. So actually having the treatment done is not something which is going to be too sore or painful, apart from maybe some mild tenderness after from the tissues that have been worked.
Yeah, and then proceeding with caution is the key to not have that reactive spasm or reactive discomfort after your treatment. So the one thing I think is important you've mentioned the loading phase, and it is crucial to do the loading phase so that we can get the best level of tension, because you can't sometimes we have patients come in now and they say, oh, give me more. They feel like more pull means better.
Yeah.
But that's not the case. It's definitely not the case in the early stages, and it's not always necessary either.
Yeah.
So you can build up to about 40 to 45% of the patient's weight in terms of force, but we typically like to start around 10 to 15%. But we won't rush it. So even if the patient wants to have more, we won't go more just because they say so. We'll increase it based on their body's abilities, based on the proof. If you got through a visit or two visits at 15%, then we'll move it up to 17 or 18%.
Yeah.
It has to be done safely and appropriately, but when doing it that way, you significantly minimize the risk of any kind of adverse reactions or events post-treatment.
Yeah, perfect. So yeah, I guess protocols and results time, obviously, we know it's not a one-hit fix, of course, but what can people expect in terms of how often they might need to be coming, what the kind of treatment times are looking like, those kind of things?
Yeah, well, it's best to look at it in terms of the people that we said would benefit it most significantly. So chronic neck pain, chronic back pain, degenerative change, disc issues.
Yeah.
This group of people, let's refer to the protocols more, as it would pertain to that type of patient.
Yeah.
If it's kind of a health and wellness general release, those are going to be different. But let's talk about these protocols that are designed for them based on the efficacy of the best evidence research available to us. So we typically range them from 8 to 16 weeks.
Yeah.
Okay, 8 would be on the bottom end. I would say the average is around a 12-week protocol. You're typically going to see people in these protocols about 20 visits, 20 sessions of decompression. The highest amount we do is 35, and the lowest amount we do is 20. The good news is the majority of people will get a significant response in 20 sessions. But if it is the case that your problem has been there significantly longer, then we would probably advise it's going to be closer to a 14 to 16-week protocol.
Yeah.
In that period of time, as I say, you're looking at about 20 to 35 sessions of decompression on its own. However, if you chose to integrate chiropractic with your care plan, those adjustments would kind of follow along the same suit, possibly once a week or twice a week, sometimes the same day as a decompression, sometimes just on a different day. But that's the time frame for you, 8 to 16 weeks, averaging about 12 for most patients. And as I said, you're looking about 20 to 35 sessions for them.
Yeah. And of course, as people start to work out the maths on that, really you're looking at somewhere between kind of 3 to 2 visits, aren't you, each week? Yeah. Particularly in that first month, it's going to be a little bit more frequent, a little bit more intense, just because your body needs that consistency and repetition to start making the adaptations that it needs from the work it's undergoing.
Yeah, well, to your point there, I think it's crucially important to say, it is a time commitment on behalf of the patients who are doing it. If you got to the point where you think this is the answer for you, it might be best for you, then it is crucial that you stick to the protocols. So 2 would be the absolute minimum a week if we would really be looking for the first 3 to 4 weeks at 3 times a week. At which point we can start dropping it down to 2 times a week after that. It doesn't really change the overall amount of visits you're going to have. It's just the period of time that you're going to have them in. But if you do them more frequently in the start, it does lend itself to a greater chance of a good result.
And how long does it take one session?
30 minutes, basically. You're going to anywhere from 20 to 28 minutes of decompression, so you allow yourself 30 minutes in the clinic. Typical average appointment times are 24 to 26 minutes where you're on the bed. The bed builds up, as you said before, to your maximum decompression for the day, and then it'll start to ease back down. As you get further into your protocol, we start to integrate some of the other features of the bed to start to help with the structure of the spine as well.
And just on those protocols again, when people should start seeing the results, yet again, when they're coming in on the first week, our aim isn't, of course, to start to get huge amounts of pain relief on that particular day or that particular week. These are usually long-standing chronic problems, and that's why the timing of the protocols is a while, because it needs that amount of time to progress. But from what we've seen, usually between about week 2 to week 4 is when we start to get some more symptomatic relief as well.
Some changes, but I would be careful on that point as well, because for people who have chronic degenerative change, one thing that we do note is they get treatment, they feel good, but they do have some reactive stiffness in the evening times on their visits. And that's perfectly normal. The body's responding to that. But that frequency of visits will help overcome that quicker. But people with degenerative change tend to see results a lot quicker than someone with a disc problem. An acute disc bulge, we have to progress significantly slower. So with those people, they're going to see the results closer to kind of 4 to 6 weeks where they start seeing changes. It is the case that they may see some more mild or modest changes, and in the odd case, some people see significant changes early. But the reality is the bulk of people with a disc problem, particularly if it's irritating a nerve root at the time, is going to see their changes 4 to 6 weeks where they'll start seeing some changes. Degenerative change, we can often see that a little bit sooner.
Good. Obviously, we spoke about it being a time commitment. Of course, also there's a financial commitment as well, isn't there? Which... Do you want to talk about that?
I think, to be prepared. I mean, it's if we compare it to spinal surgery or something, where you could be looking at anywhere from 12 to 16,000. Our lower end ones are about 1,200, and the upper end is at 2,500 for care. The majority of people will fall within the 12 to 1,500 range. I think so far we'd probably say we're about 85 to 90% fall within that range. If people are using it as an individual visit, it's £80 a visit. And they might want to use a few visits in association with their chiropractic care because they just need a little bit of relief from it. But they don't have a significant enough problem to go into a protocol. That's the way the financial commitment works. So it's anywhere from 12 to 2,500. And then the payment system works that it's 50%. Whatever protocol you do, it's 50% up front, and then you can divide the other two into 50-50, 25 and 25%, 4 weeks and 8 weeks. So it makes it a little bit easier to spread it out over time. But I'm always conscious to advise people that that are getting involved. And a couple of people have done this where they start seeing a bit of relief and they reduce their frequency. They've paid for it. It stands to reason that if you're going to pay for it, commit the time to go through with it to get the best result. Your symptoms can waver. They can go up. They can go down. I understand the thought that, hey, if I'm feeling better, I should start to I can reduce this or miss this one because it's not kind of a prevalent thought in your mind. But you should be thinking about trying to maximally correct the underlying issue as best as possible. And in order to do that, these protocols follow an evidence-based approach to do that.
I think it's the same principle, isn't it? When your doctor gives you some antibiotics and they say even if you're feeling a little bit better, see that process through because it's no pain, no problem is sometimes how we can all see it. But I think it's important because we're trying to get long-standing change to long-term problems, but we don't just get excited about that first bit of relief and try and actually make sure we fully get on top of these issues as well.
Yeah, definitely.
Awesome.
Agreed.
Perfect. Spinal decompression, it's not new, is it? Obviously, there's been some variations of it for quite a long time. Probably one of the more famous and more popular ones has been the inversion tables. We've had inversion tables in the clinics, haven't we, at certain points? What's the difference between an MC core or spinal decompression unit we've got in here versus an inversion table?
Well, an inversion table is using gravity. Okay, so it does what it says. It inverts you. So you're almost upside down, and you've got the force of gravity pulling down through all the joints of the body. And it does do distraction or decompresses the spine, and in many cases feels pretty good. It's not for everyone though. If you have acute issue, you might find difficulties doing it. Hanging up where you're strapped in by your ankles. If you have any kind of prosthetic knee or prosthetic hip, that's going to prevent you from using these things in most instances. And you're just using gravity to come down. Okay, so once you come back, everything comes back the other way and you're loaded. And you can have the risk of muscle spasm, things like that, but also hanging upside down, a lot of blood rushing to the head as well. So the prolonged period of time you're not going to be able to use it for. Having said that, for some people, we've seen it ourselves in our clinics, it does a lot of good for a lot of people, but it doesn't have the lasting change that we're looking for. It doesn't have mobility of the segments of the spine, lateral flexion, so it lacks that in that area. So it's a bit more comprehensive, the MT core that we have, significantly more comprehensive. And also you can be in that position for a prolonged period of time, isolate segments of the spine as opposed to distracting the full spine, and be very effective for those segments.
Yeah, I'd also just add on that, obviously, for people with inversion tables who might be thinking about it, if you have any kind of blood pressure issues or cardiovascular issues, inversion tables most likely aren't suitable for you. Also, if there's any issues, any ear or eye problems that could be causing dizziness, again, you probably need to speak to a healthcare practitioner before you use an inversion table. I would say there's probably a few more contraindications in terms of people who can't use inversion tables as well. Is probably one of the big things. But it's an evolution of that, isn't it? Inversion tables have been around for a very, very long time.
They're cost-effective as well.
Cost-effective, still get a lot of great results for a lot of people. But this is just an evolution of that, and trying to allow it to help more people and help people more is what I'd probably say is, if the inversion table's a horse and carriage, then this is more of a smart car, just a moving forward of that.
In summary, spinal decompression, in particular, the technology that we have with the MT core, is going to allow us to do a lot of good for a significant amount of people. It's going to allow us to treat existing patients and bring them to the next level of improvement. But it's also going to allow us to take on patients who we may not have been able to help previously, because the technology is doing something that we can't do with our hands. So that's the significance that it brings to our practice. It's great for those patients. It's great for us. So we look forward to using it on more and more people. And it's kind of, for myself, I have a relatively healthy spine now, but I use it twice a week at the moment, maybe because I have the novelty of I have it here and I can just jump on it when I want. But it's going to be part of my spinal hygiene routine. I'm going to be using it at least once or twice a month to keep my spine decompressed, to keep my discs hydrated, and to keep my spine as healthy as possible for as long as possible. I mean, that comes with doing other things. As you know, I kind of started doing Pilates, doing a few other things to help with that. It's not the only thing you should be doing, but it's a significant addition to keeping your spine healthy.
And of course, the day-to-day now of most people, compressive forces on their spine is a big thing. The amount of time we're spending driving, sitting at desks, phone screens, all of these things, even training heavy in the gym, they're all quite compressive forces day to day. And so, of course, like you said there, it can be part of a good maintenance routine of your body alongside other things that you just kind of mentioned there as well. So, it's not just for people in pain. It can obviously be really good for people's wellness and maintenance of their body and spine. Thank you for listening to that, guys. I hope you found it informative. If you're interested in finding out even more information or whether you want to get booked in, then just feel free to contact us. Also, we're going to be doing more of these kind of educational podcast sessions. So if there's anything you want us to cover, feel free to leave a comment and we'll try and do it.